Let me just start by saying that I'm not here today as the head of the infectious disease division at the Ottawa Hospital. No one ever told me in my job description to go forward and start a supervised injection site in Ottawa. I'm here because I've seen too many overdose deaths, I've seen too many needless HIV infections, I've seen too much violence and too much suffering, and I feel it's my professional obligation to speak out about this issue. It was 2 years ago today, September 30th, 2011, that the Supreme Court of Canada ruled that the health and social benefits gained by the people who use the services at Insite, Canada's first supervised injection site, far outweigh the drug prohibition arguments of the federal government, who spent years trying to close it down. By the time the case was heard by the Supreme Court, almost 8 years after Insite was opened, over 12,000 different individuals had used Insite, and the benefits were impressive. People who regularly used Insite were using less drugs. They were entering detox and other drug treatment for the very first time. They were accessing primary care and reducing their visits to hospitals. People liked it. People felt supported, and people felt safe, maybe for the first time in their whole lives. During the same time period, there were dramatic decreases in both HIV infections and fatal overdoses in the neighborhood, at least some of which could be attributed to Insite. Further, there was no increase in crime, there was far less public injecting, and fewer discarded needles on the streets. The police chief, the mayor, the provincial government, and local businesses all came out publicly to support Insite. How could they not? Perhaps even more importantly, the court made it clear that drug addiction and the devastating health and social consequences could not be fixed by the criminal justice system. Like other health issues, people with addictions are entitled to prevention, treatment, and health services. Just because drug users are involved in an illegal activity does not mean that they forfeit their human rights, including their right to health. Insite saved lives and improved people's health, and that was a key part of the Supreme Court decision. For those of us who are pushing for a site in Ottawa, it should be crystal clear that we are ultimately working for exactly the same thing as those who would oppose it. The question today should not focus on why we need a supervised injection site in Ottawa, but rather, how can we reduce the suffering of people who use drugs? How can we reduce HIV and hepatitis C infections? How can we reduce open drug use in our streets? How can we reduce drug-related crime and violence? How can we reduce overdose deaths? And ultimately, how can we help people get off drugs? We need a plan, and we need it now. It is unacceptable to just say no to an intervention that is proven to make a difference, namely a supervised injection site, without any alternative ideas. I want people to understand that a supervised injection site provides a critical lifeline to people who inject drugs. These are sons and daughters, brothers and sisters, mothers and fathers, who are among the most marginalized, stigmatized, demonized, and most poorly understood people in our whole community. Most have tried to quit drugs, most have tried addiction treatment, and most have spent a lot of time in jail. It just hasn't worked out for them. It is time to try something entirely new, and that's why we're here today. To those who are opposed to this or unsure about the merits of opening a supervised injection site in Ottawa, I can assure you that if I thought for 1 minute that opening a supervised injection site would lead to more drug use, less motivation for people to enter drug treatment, more crime, more drug dealing, more discarded needles, then clearly I would not be here today. In over 90 such facilities around the world, this has not been the case. The whole concept of a supervised injection site is to address these very concerns. Well before the Supreme Court decision of 2011, many experienced healthcare workers, along with people from a range of diverse backgrounds, were advocating for a supervised injection site in Ottawa as part of a general call to expand harm reduction services in the city. Progress has been slow but steady, and today we are proud to present a mock site in an attempt to demystify the workings of a supervised injection site and to show people that it's not that scary. We hope today is another step toward an open and constructive dialogue. We invite any and all questions as part of an ongoing process of community engagement. If there are people who want to get involved, there will be plenty of opportunities. And at the end of the day, this is simply the right thing to do. Thank you very much.